topic of traumatic brain injuries because it is a very prevalent injury sustained while serving in the armed forces, of which I am currently enlisted in. I personally have friends that suffer from traumatic brain injuries, one of which I will detail later in this presentation. To begin, let's define what a traumatic brain injury is defined as. The U.S. Army Medical Department Journal states that a TBI occurs when an external force or a rapid acceleration or deceleration force causes damage to the brain. This type of injury is an important cause of disability in adults, resulting in tremendous human and financial cost, leaving those affected with often unseen wounds. Traumatic brain injuries are the signature injury of the wars in Iraq and Afghanistan. It has been stated that upwards of 20% of the over 2 million U.S. troops deployed to Iraq or Afghanistan meet the criteria for having a TBI. Deployed troops tend to suffer mainly from mild TBIs as a result of blast injuries dealt by explosives, as you see here in this photo. TBIs can occur from the blast while conducting combat patrols on foot, or most commonly seen as a result of improvised explosive device attacks while in vehicles, as seen in the photos here. More than 2 million TBI events occur in the U.S., resulting in 300,000 hospitalizations and more than 50,000 deaths. This results in an estimated national cost to the United States of nearly $17 billion. TBIs have been recognized as the most common form of death and disability among those between the ages of 1 and 40 in the United Kingdom. Civilian TBIs are mainly due to occurrences such as falls, sports, and vehicle accidents. Traumatic brain injuries can be classified as mild, moderate, and severe based upon the Glasgow Coma Scale, as you see here. Now that we have identified the main causes of traumatic brain injuries, let's look at the signs and symptoms of traumatic brain injuries. In an interview with retired Master Sergeant Roth, a former medic with the U.S. Army's 5th Special Forces Group, he identified a TBI from a roadside bomb in Iraq as a direct result of his short-term memory loss and attention deficits. Master Sergeant Roth, pictured left, identified other potential TBI symptoms as anger and irritability, generally feeling weak, trouble hearing, ringing in the ears, dimming vision, severe memory loss, trouble sleeping, numbness or tingling in the hands or feet, anxiety, and some level of personality change, as well as dizziness. There are many symptoms of traumatic brain injuries, and thankfully greater awareness of this type of injury and improving technology has led to greater treatment options for our military members and those among us that have suffered such injuries in the civilian world. One of the greatest challenges has been identifying those that suffer from a TBI, and thanks to advancements in neural imaging technology and techniques, there has been a great increase in the rate of identifying and treating those with traumatic brain injuries. Due to the wars in Iraq and Afghanistan, the U.S. military has become fully aware of traumatic brain injuries and has implemented the post-deployment health assessment, as you see here, and in order to better identify those in need of treatment. The treatment stages for TBIs have been identified as the initial treatment, which is stabilizing the patient following the TBI, the rehabilitative treatment stage, which involves restoring the patient to normal functions, and the surgical and acute treatment stage, which incorporates the prevention of a secondary head injury and the renewal of blood and oxygen flow to the brain. Thank you.